Well, sore and scratchy throats are definitely in season, although we don't like to hear that. And there are plenty of reasons why, everything from allergens in the air to that mystery bug going around. So how do you know when it's something more serious? The experts at Ohio ENT and allergy physicians can certainly help. So joining me today once again is Dr. Evan Tobin. So good to see you, doctor.
Thank you, Robin.
Okay, so today we're going to look at the tonsils, all the problems that can kind of arise in that area. So for starters, what are the tonsils? What are the adenoids? I was looking at this photo going, you know, the dangly thing, what's that? A lot of people probably wonder.
Right. Well, we'll start with the dangly thing. That's the uvula, and we're not talking about the uvula today. We're going to talk about the tonsils and adenoids.
Okay.
Our tonsils and adenoids are part of our lymphoid system, which is part of our immune system. The tonsils are located in the back of the throat. They're normally small, walnut-sized structures. The adenoids are located above the tonsils in the back part of the nasal passage. And then there's even a tonsil at the back of the tongue called the lingual tonsil, which is one that we really don't have too much trouble with. But in general, the tonsils and adenoids, they filter, they trap bacteria and viruses and help us to fight off those infections.
So where do things go wrong?
Well, things go wrong for a couple of different reasons. Infection is the first thing that we think about. Infection can occur in the tonsils and adenoids as they're trying to do their job of fighting infection. They themselves can become infected, and that leads to sore throat, and we're all familiar with that. But the sore throats can become recurrent and can become a problem. The other problem that can occur with the tonsils and adenoids is enlargement. And when the tonsils or adenoids become enlarged, they can lead to snoring and sleep apnea in kids and adults. They can cause problems with swallowing or speech. In some kids, they can lead to poor sleep, leading to ADD and ADHD or bedwetting. A lot of things that people may not think about as a tonsil or adenoid problem.
Yeah, definitely. That's interesting. So what's the difference when you look at, between strep throat? You get a sore throat and kind of, that's the first thing I feel like a lot of people think I might have strep.
Right.
There's also tonsillitis. How do you know what you have?
The terms are confusing and there's a lot of overlapping. So a sore throat is obviously anything that's uncomfortable in the back of our throat, and it turns out that tonsillitis or inflammation of the tonsils is a common cause of a sore throat. Now that term can mean a viral infection or a bacterial infection in the tonsils, and so that's tonsillitis. Strep throat is a particular type of tonsillitis caused by the strep bacteria, and we care about that bacteria because if it is not treated, not identified and treated, it can cause complications. These can be heart complications, kidney complications, problems with our joints. And so that's why if you have a sore throat, your doctor wants to test for strep. So they do a swab and they try to identify. If it's positive for strep, it's called strep throat or strep tonsillitis or strep pharyngitis, and it will be treated with antibiotics. If it's test negative, it still is tonsillitis or pharyngitis, and it still may be given an antibiotic, but we're not as worried about those complications in those cases.
So how do you know when it goes beyond the sore throat? Is it just a length of sickness where you need to say, I need to see a doctor at this point? That's
part of it. Some of it is the severity of the sore throat. Typically someone who's got tonsillitis or strep throat, they look sick. It's not just a scratchy throat and normal cold symptoms. It's often a sore throat and no other upper respiratory symptoms. Maybe a fever, there may be some belly pain, there may be some swollen lymph glands in the neck. And certainly if there's been a history of strep exposure or recent strep throat, those are patients that need to get to their primary care doctor and get a strep test.
And a lot of people, I know when I was a child, you hear of kids getting their tonsils removed. Is that still a common solution, and what really is that a solution for?
Yeah, tonsillectomy used to be almost a rite of passage. You got to a certain age, if your tonsils are big, you got your tonsils out. And we learned that didn't need to be done in most cases. But we look for kids and some adults who will benefit by the surgery, and those tend to be children who are getting recurrent sore throats, so many episodes of tonsillitis in 1 year, or 5 in a row, or 5 a year and 2 years in a row, or 3 a year, 3 years in a row, so it's affecting their quality of life. Or people that have enlarged tonsils and adenoids where it's causing obstruction, like snoring or sleep apnea.
Okay, so if you have any of these issues, the best solution is probably to come in and get checked out,
right.
See what you're dealing with. You can do that at Ohio ENT and Allergy Physician. So thank you, Dr. Tobin, for being here.
Thank you very much.